785 million people in the world are literate, with two-thirds being women, and 99% of illiterate adults live in developing countries. Oftentimes in these developing countries, the nearest school is hours away on foot with a journey of difficult terrain. And when they finally get to school, there are very few, if any, textbooks, the building is poor, and teachers often have to manage groups of over 50 students. Here's a school in South Sudan where the literacy rate is 26%. If parents have to choose between sending their child to school and having them help out at home or working, the logical choice is to have them work. And because illiterate parents can't teach their kids how to read, the cycle continues. Poverty and disease correlate directly with low literacy. People are unable to read labels on food and medicine, and global health organizations have trouble communicating potentially life-saving messages to developing countries about health issues.
Here, this map depicts a very stark contrast between countries that have high literacy rates, which are mainly developed countries, versus low ones, which are mostly undeveloped, impoverished nations. The key indicates that in most of Africa, the literacy rate of people aged 15 and above hit much lower than neighboring continents and nations. One of the tools that have been developed to tackle the problem of illiteracy in impoverished countries is speaking books. It was founded in 2004 by the founder of the South African Depression and Anxiety Group, Zane Wilson. The SADAG was looking to combat teen mental health issues in South Africa, but found that illiteracy rate was a barrier to distributing information, so Wilson developed speaking books. They are interactive audiobooks that use culturally relevant illustrations and text in native languages to better inform a community, as the book is directly catered to them. One book can reach over 120 people, bridging the communication gap illiterate communities often face. Books are developed in various stages. First, the topic is established, then authors and artists develop text, record audio, create illustrations, and then finally, the book is assembled and shipped, all in accordance to the cultural interests of the community. Speaking books mainly cater to three areas of focus: health education and disease prevention, social development, and early childhood education. In terms of health education, illiteracy is a barrier when trying to navigate services, read and understand directions, and medications. This issue correlates to a 12 to 18 times increase in confusion when taking medication or following procedures. As a result, Speaking Books has developed titles to educate communities on malaria, pneumonia, and HIV and AIDS, in addition to books on suicide prevention and sexual abuse. In order to develop social inclusion, Speaking Books publishes titles that tackle development topics such as job training and anti-bullying, mainly hoping to educate people on options to improve their well-being and lives. So far, Speaking Books has published 500,000 books on 65 topics in 35 languages in 30 countries around the world. Speaking Books' use has even extended to the World Health Organization, who published a book on preventing non-communicable diseases like cancer, diabetes, and heart disease in an effort to educate illiterate audiences. In addition, multiple studies have been conducted to validate the effectiveness of the books. In the 2014 Journal of Clinical Research and Bioethics, researchers organized two groups of participants in Uganda to attend information sessions. One group had a take-home speaking book supplement, while the other did not. When they came back to take a test on the information that was presented to them, the participants with the speaking book did significantly better on the test.
Here, women learn about the medicine and the possibility of employment in that field. The books are clearly catered to their demographic, making them relatable and effective. The Pushcart Classroom, created in 1999 by Efren Peña Florida, was another effort to combat illiteracy and barriers to education. Peña Florida grew up in the streets of Manila, Philippines, and experienced firsthand the educational barriers that face young children in his city. When he was young, he was pressured to join a gang. This was common when he grew up, and he wanted to do something to combat this issue and encourage youth to stay in school. Due to parents' lack of interest in enrolling their children in school and a lack of official documents, like birth certificates, there are 6.2 million primary-age students out of school in the Philippines and thousands of children out of school in Manila. In 1997, he and a few friends started Dynamic Teen Company. A couple years later, the team developed the Pushcart Classroom as an alternative learning system to educate children on the streets. The portable classrooms are equipped with books, other educational supplies, and even first aid kits and food. The initiative started very small scale. The group used money from recycling bottles and selling crafts to fund the carts, and teachers were actually all volunteers. The small group would go around the streets of Manila and teach children how to read and write. Kids were drawn in by the food which was provided to them, and stayed because of how accessible and easy it was to learn in a setting different from the one that they were used to. But of course, the goal of the Pushcart Classroom is to be a bridge to traditional education. Equipped with the skills and motivation necessary to succeed in a traditional classroom setting, many children return to, or start going to in some cases, their nearby schools after being taught by volunteers of the pushcart classrooms. Since its creation, the company has gained over 10,000 members and has mentored and taught over 1,500 local children. In 2009, Peña Florida received CNN's Hero of the Year award of $100,000. And the pushcart classroom has been replicated by different organizations over 50 times across the country. Both the pushcart classroom and speaking books have been exemplary organizations with the drive to combat illiteracy. With a narrow focus, they are able to make a large impact in education. With volunteers from their own hometowns, the pushcart classrooms provide direct contact with the children they help, while speaking books can distribute information on a larger scale. Both organizations provide sustainable options for communities in impoverished countries that have low literacy rates.